to get started, folks.
Washington's 106.7 WJFK. Here starts Ron and Fez.
Okay, good. You're in for that, right?
Ron and Fez.
Now, I heard Jack Osborne is out of rehab. I heard he's out loose. Someone saw him eating some food or something.
Did he go in the Scientology rehab like Billy?
You know what? I'm not sure exactly what Jack Osborne's program was, but it could have been that purification thing, like Billy's thinking about going into, because the picture I saw, he looked great. The eyes were sparkling.
Yeah.
Still had the weight on, but
Sure, you eat good in rehab, because it's not a fat camp. You know, you eat all you can.
they wouldn't mind if they worked, on all aspects.
All right, Billy, come on in here, because probably with the Scientology, you're going to drop a little weight.
I would think so.
Say, yeah.
Just, if he just goes out and does some walking. If that's part of his program. If he walks the grounds down at the compound.
Stay off the starches when you're in there, Billy.
And I think you could probably work on mind, body, and soul. And liver.
The whole bit?
The whole thing. The whole kit and caboodle.
What happened with your shrink today? Are you ever going to go back?
I told her when I went in I didn't want to make another appointment because I had to wait and see how I felt.
How do you feel?
She gave me one for Saturday, and I said I'd play it by ear. You know, I have an appointment to see her Saturday.
Cat and mouse game with you and her, huh?
It's just a question of...
She's not good enough for you.
No, she's real good. She really is. And, actually, she was very smooth. Because she just took out the appointment book and said, how's Saturday, 11:45 for you?
You love that kind of attention, don't you?
What do you mean?
The attention of a woman trying to trick you into something.
Well, no, I was just aware of it. I was just like, oh, okay, that's very slick. I mean, you're not going to fool me. I saw what she was up to.
Yeah.
It's like a salesman. You know, salesman.
What did you find out today?
Just that I'm a wreck. Just that I'm a wreck. And
well, you knew that going in.
You think it's from all the pills that your shrink's giving you?
No, not at all. I just think that maybe it's a misdiagnosis somewhere. I think I'm more effed up in the head than they realize.
Does your therapist ever consult with your psychiatrist?
Yeah, as a matter of fact, she was doing that today. After I left, because after what
just
happened.
now, finally.
Oh no, they do. She recommended him. She's the one who.
They're married.
No, they're not. They don't even live in the same house.
Sounds like some sort of pyramid scheme.
Would you be mad if you found out that your psychiatrist and your psychologist were laughing on the phone together?
That would be horrible.
Guess who was in here today?
No, that would be terrible.
It would be rough, wouldn't it?
Yeah, I mean, because the whole thing about the therapist is, and when I go in there, it's like she says she'll never judge me. Whatever I have to say or admit to. Or,
like me and Fez with you.
We're judgeless.
Judgeless, yes.
We don't judge you.
We just want to help you. We want to get you into the Scientology program.
Did anything come up in particular today, Billy?
Nothing, I really don't want to go into a lot of the detail, but she did, for the first time in a year and a half, she did get me to cry. Was it because you remember someone touched your balls?
Was it a ball cry?
No, it's not a ball cry.
Not the ass. They didn't get in your ass.
No, it was no ass. It was just a...
Because you got every right to cry. They did that.
Yeah,
Did somebody stick something in your mouth that shouldn't have been there?
No, that's not what I was trying. No.
Were these D tears?
No D tears. No balls.
Well, why would you start crying?
What's left, Nips?
What were you thinking about, being a lifetime Jets fan? And I got you balling?
Don't get me started.
What was it? What was it in particular? Something Fez said? Let me guess. Was it Fez's caustic sense of humor?
I guarantee you it was not me that made him cry.
I'll tell you this, sometimes I feel like I'm welling up when you get going.
Well, Fez does come up more in therapy than you do, Ron.
Thank you.
In a good way?
No one ever comes up in a good way, sir. No one's ever going to say to the therapist, hey, I have a really nice friend.
What are you saying about me that's getting put on your permanent record?
You know what? If you want, I'll write a note to her. What's her name?
Do not write that note.
Dr. Vinny Boombat?
Roberta.
It's Sultana.
Oh, you're on a first-name basis?
Yes.
You call her Roberta?
Mm-hmm. And she calls me Billy.
Of course.
What else is she going to call you?
She's going to talk down to you.
The other thing she's going to call you is a wagon for pickup.
Now, Billy, the folks from ronfez.net, and I don't want to say which one it is, but they have a therapist lined up tonight, and we want to talk to her on the air. Maybe that would help us. help you, like in Jerry Maguire. Help us help you.
If it'll make you feel better, I'll do it.
Help us help you.
Fine, if this will help you feel better
Billy,
about helping me.
Billy, it's not your fault.
Okay.
It's not your fault.
I know it's not, and I just
look at me. It's not your fault.
I can't look at you. It's shame.
Look at me.
It's shame.
Look at me, eyes.
No, it's shame. My therapist.
Billy? Was it bad, Billy?
Huh?
Yeah.
Move in and hug him now.
Billy, would you like me to hug you like your parents never did?
The right way?
No. That's something that can't be replaced.
And you didn't do it, did they?
It was a nice try, a nice gesture, though, Ron.
It's not your fault.
You didn't get a hug.
If you want
Let me ask you this, Billy. Do you tell them that you're an addict?
Who doesn't know?
The people at Scientology that I'm trying to get you in with.
I have not spoken with them yet, but my therapist does, my psychiatrist does.
You know what? I need your waist size for the uniform.
You said there wasn't uniform.
Well, in case.
I mean, if you want one.
Right.
There's like a thing that you can pick up on the way out.
I'm sure there's a gift shop.
I don't look good in jumpsuits.
You know what? How quick before you think Billy would love it in that rehab in Scientology?
I'd say by lunch.
Yeah, me too.
No, I'm not good. I'm not good with discipline.
Oh, it's not about discipline, my friend. It's just the opposite. You free your mind and the rest will follow.
You're going to be like Dewey Oxburger in Stripes.
Before you even leave.
My doctor says I swallow a lot of aggression. Along with a lot of pizzas.
How many pills did you take today, Billy?
3.
We're going to get you out of that. Endocrinology. I call it pathology.
They switch my pills, and these things do squat.
You don't feel anything from your pills? Any difference whatsoever?
No, they switched them to something else, and that's why I called my psychiatrist. I was like,
did you bring up an E-meter with your shrink? That maybe you need to be on an E-meter?
No.
Meter some of those E's?
What is
See what your E's are doing?
What are my E's?
Your electromagnetic things.
We're going to clear you, buddy.
Where do the clay pots come in?
I don't even know what you're talking about with clay pots.
You bring up clay pots, and he got beat by Ruben on American Idol. That's all I know.
No, I thought it was something with clay meters or clay, and they have clay bags.
I'm sure there's some sort of arts and crafts things if you want to deal with the clay.
How many placebos a day are you on now?
I know, because maybe they're giving you Tic Tacs or something.
I don't know, but whatever these things are, they're definitely not worth. I might as well be taking Tic Tacs for as lousy as I feel. I mean, the Xanax was helping for a little bit, but...
Did they give you new prescriptions today?
No. I didn't see the psychiatrist.
Oh, just the therapist.
Just the therapist. Boy, I hadn't seen him in a couple of weeks.
Because this prescription is for good and plenty.
Did you walk in crying?
No.
How hard did you cry? Were you really squirting them out? Did you have to have a tissue?
Oh, half a box.
Were you punching a pillow?
No, there wasn't.
Biting it?
It was.
Go ahead.
It wasn't an anger. It wasn't an angry cry. It was a cry of pain. It was a cry of pain.
How long did the crying jag go on for?
Well, it started about 15 minutes in and lasted about an hour.
Whoa.
I'm just.
How long's your session?
It's usually 45 minutes. She gave me double time.
People in the waiting room were just hearing him in there.
She has a sound machine. So
Yeah, Miami sound machine.
Oh, that's nice. Come on, baby, do that conga.
Do they still do that?
Oh, sure.
Yeah, I love it.
It's a hit.
Yeah.
So, Billy, let me ask you this. With the crying situation, and it went on for like an hour and stuff, did that feel better at the end?
No, I felt so emotionally drained and physically exhausted. I mean, even now, my eyes are killing me. My eyes are physically, actually, I feel like I got surgery in my eyes or something. I'm like drained. I feel like totally empty inside.
What was the thing that made you start crying? Do you remember? So I could bring it up from time to time.
Just that I'm just pissed off that I have to deal with this addiction. You know, it's like, why me? You know, why can't I be like everyone else? You know, why do I have to fight this goddamn thing all the time? You know, and lapse and relapse, and you know, why can't I just be like everyone else?
You ever say, why can't I be in a wheelchair like some people?
No, I'm not going to.
Why can't I have cancer like a lot of people I read about?
Those lucky people getting pushed everywhere?
Why didn't my wife give birth to conjoined twins? I mean, there's a lot of bullshit you dodge.
Just like I told my therapist, we can play this game forever and ever and ever. Why can't I be, why, is it good, is it bad, or whatever? But this is what I have. And this is what which is bothering me. And because I'm losing the battle with it, it's pissing me off.
But not everybody is not an addict.
No, but I am.
Right.
And I'm pissed off about it.
That's what I'm saying, though. But, it could be anything. This is yours.
Yeah. I mean, there were a lot.
What are you learning from it, maybe?
There are a lot of other issues. I mean, and this is just the one most recently. I mean, like the going out drinking this weekend was a symptom of everything that's been building up to it. I mean, there's a lot of other stresses and BS and crap in my life, so.
Because you were filled up, was it a babysitter or something feeling you up?
As much as I would love to recall, she did ask me this about a molestation incident.
Yeah.
There really was not one that I've ever remembered.
Did you tell her about the ones that you actually did?
Oh, yeah.
That you performed?
Yeah. The accidental touching.
With a baby, too.
No, baby. No.
How did she react to that? Does she have any sort of button in there that can call the cops in case someone gets nuts?
No, but I did ask her what the law was about confessing to a crime and stuff.
What did she say? With the therapist-patient confidentiality thing?
Yeah, because I remember that from The Sopranos.
And Scott Peterson, what did she say to you?
I didn't murder my wife.
And you know who did.
She just said that only if you are going to admit that you're going to hurt someone.
In the future.
Yeah.
Yeah, like if you go to your shrink and say, within a week I'm going to kill.
Yeah.
Then they squill.
I told her about my fascination with, lately I've been thinking about taking people hostage and killing them.
Right.
Yeah.
And rape? You told her about the rape?
I told her about the rape.
Were you wanking at her?
And she goes, no, it doesn't.
Okay, I don't know how it works.
It's not
You won't let me go in? I would love to go in.
No, it's like, and she just simply
I'd be afraid I wouldn't be able to get you back out.
All right, we've got a doctor that's going to talk to you.
Okay, but let me just finish by saying she simply said to me, did you do any of those things? Did you, hold people hostage and kill them? Did you rape anybody? And I said, no.
Not yet.
So, so far, so
Do you think
good.
you will?
I don't know.
So far, so good.
It's just that I feel like I have it in me, and it's always been there, but it just seems like it's getting closer.
All right, Billy, we're going to start a session with you.
Mm-hmm.
And is the doctor we have?
Oh, yeah.
Should we say who from RunFez.net or just say it's the good folks from RunFez.net?
I think it's just good folks.
Yeah. Which is nice, Billy, which means people are trying to help you.
That means they care. That they're sending in help.
And just because you don't have, let's say, your mom or Fez in your corner, it doesn't mean me and RunFez.net aren't there for you.
You know I'm in your corner, and please don't bring me up anymore at these therapy sessions.
You know what?
No.
I can't wait till Rory gets his therapy session and talks about whatever you've done to him. You got him to get agita now.
Stop saying terrible, terrible things about me and my family.
Yes.
I have not said anything about you and your family.
You bring up the weight issues for him, his wife. You bring up the mom's hot dog thing.
Yes, in order to help.
Sometimes you're on him so bad, I feel like I want a Xanax.
If you get one, get two.
All right, we're going to take a little break. We'll have a doctor on to talk with you. Billy, would you be totally honest?
As much as I can on the air.
No, I want you to be 100%.
Sure.
It's either that or you're getting on a JetBlue and you're going to Scientology.
All right, I'll be 100% honest.
My Corky will pick you up, put you in the bed of the truck, and take you.
I've always wanted a friend in Scientology. And you could be the guy.
Why am I the guinea pig?
Lisa Marie.
She's not going to be there.
Yeah, she's there a lot.
Oh, yeah, she's
there a
always
lot.
there. It's summertime.
Yeah, she loves it. And you could be the next daughter of Elvis. You play your cards right.
I do have professionals that I do deal with this.
I know, but I want you to talk to the doctor. And if there's any possible way you could squirt out a couple for us, I would love it. Because I'm going to tell you right now, you start crying, who's going to turn off the radio? Nobody.
I'm so glad that...
Other than, of course, Alan.
Yeah.
They'll turn it off immediately and go, I can't stand this anymore. But you break down for us, big man.
You see what you can do.
And try to remember get molested.
No, enough. All right, let's just do this already. I'm not going to guarantee you
don't make it a bad thing.
No, but it's like,
you promise me good.
It's like I'm a dancing monkey here. Like I got to perform and cry in order to have emotions and feelings.
Hey, Not going to put a monkey in therapy.
I consider that a breakthrough. Let you get it. All right, I'll tell you what we'll do. We'll have the doctor on one line, and I'll just have some booze set up down the table.
That'll help.
Every time you cry, another shot of booze.
And you can pick the lady or the tiger.
We'll be right back with Billy's therapy on Ron and Fez.
Billy Staples in the studio with us tonight. And we're going to try and get him some help. The folks at ronfez.net have tried to hook him up here. Because everyone cares about Billy.
We have Dr. Tolson on the line. Doctor, welcome to Ron and Fez. How are you?
I'm fine. We have a dreadful connection.
It's a bad connection?
Yeah. I'll just shout loudly and you can do the same.
Okay, you have trouble hearing us?
I can decipher enough.
Okay, if you want, we can try to reconnect on the other line.
You want
That would be great.
Okay.
Okay, we'll try to call you back.
All
All
right.
right, do you have her number there?
All right, so call Dr. Tolson back. Dr. Tolson is a clinical psychologist.
You know exactly what that means, Fez?
No, not exactly. I guess a clinical psychologist, I'm just guessing, is more of a medical field.
I see. So maybe if we hit Billy in the head with a bag of nickels, she can cart him off for us.
Yeah, well, I'm sure she has the power to do so.
Why is it always nickels?
It's heavy, and if it bursts, it's not too expensive.
Yeah, I'm not going to waste quarters.
Yeah.
I never heard it before, and that was the second time you mentioned it. I was just curious.
Yeah.
It's all part of your therapy. All you have to do is relax and take it in.
Mm-hmm.
Okay, I believe we have Dr. Tolson back.
Let's try again. Dr. Tolson, is that a better connection?
A bit. You still sound like you're in the bottom of the tunnel, but we should be able to manage.
Okay.
How are you?
Hi, Dr. Tolson.
Dr. Tolson, this is Billy.
I'm Billy. I'm the one that you are going to help.
All right, Billy, why don't you just explain a little bit of your history?
Well, I am an alcoholic. I'm an addict. I've relapsed many, many, many times. Been to 5 rehabs, 2 divorces, put together a few months of sobriety recently. Went out drinking and partying again this weekend. Feel suicidal. Actually, I've taken too many pills a couple of times this past week, hoping I didn't wake up. I've had suicidal thoughts. And
What pills were you taking?
Whatever I had. I took Klonopins and Xanax.
How many did you take?
6. Well, I don't know. I've never done it before, but the fun thing is I've never acted on it before. I came home after partying and I said, you know what? Boom, let me go to sleep. And it's a combination. This has been the symptom of stuff that's been brewing inside of me. I've just, you know what? The bottom line is I am tired. I'm tired of fighting everything in my life.
Sweetheart, I'm exhausted hearing this. First
Can
of
you
all,
imagine living it?
I can imagine. First of all, if you were to walk into my office, do you know what the first question you'd be asked would be?
No.
What do you want? And I think that would probably be the most difficult question for you to answer. So we might want to start with that.
What do I want?
Yeah.
I want the pain to go away. I want to stop feeling pain all the freaking time. I want to stop hurting and I want to be like everyone else. I don't want to be an addict. I don't want to be a freaking alcoholic. It's like I don't want to have to always screw up, be the guy who's always making mistakes, the guy who's I just want to be like everyone else. I mean, is that too much to ask?
Sweet, let's start from the very beginning. First of all, you just stacked a lot of things up real high. So I can't manage a pile like that. But what I can do is break it down into things we can handle.
Okay.
Number 1, you've defined yourself 3 times in 3 minutes as an addict and an alcoholic. Those are jobs. What about if I fire you from those jobs? You still will drink right now, and you still will use drugs right now, and you still will be in pain right now. But we're going to fire you as a pain-filled person, an addict, and an alcoholic. In other words, you will have to choose each and every time you do that. You no longer get to be an alcoholic. Because if you are an alcoholic, you're doing a swimmingly good job.
Yeah.
Does that make sense?
You know what? The word doesn't make sense. Yeah. Do I have the right now? Do I have the will to do it again? Do I feel like there's any hope? No.
Just one time.
Yeah.
Just one time. And this is not a 12. I'm actually absolutely opposed to 12-step programs. I find them unhelpful because if you are an alcoholic, by definition, you are someone who uses alcohol, okay? I have worked with people who describe themselves as an alcoholic, and they haven't had a drink in 25 years. So how can they be a very good alcoholic? Is that...
I don't... You know what?
In other words, self-definition can be absolutely the most deadly thing in the world. We're not going to define you those ways anymore.
Well, the problem lies is how I feel about myself. I mean, as myself, I don't like myself.
You're waiting for permission for you to be okay. Remove the alcohol issue, remove the drug issue, remove the in-pain issue, remove the relationship dysfunction issue, and then Billy's going to start. I reject that completely. I find that not only unhelpful to you, but kind of insulting to you. You don't need a place to start. We're going to start right now with what we've got.
How do I start? What is it that I do? I mean,
we're going to find out what you want. I'm going to back you into that goal, and they're going to have mini goals that will lead to major goals. It's a pretty simple process. You're looking at a giant. This is really a cliche, but you're looking at a freaking avalanche, and it's coming at you. I'd bury my head in the snow too. I'm thinking about making snowballs because those we can handle.
Maybe, Doctor, maybe he wants to be taking baby steps.
I'm sorry?
Maybe baby steps is the answer.
Well, it's not even baby steps. You're still looking for that self-definition. I'm going to remove, if you were my patient, and for purposes of conversation, I'm going to make you my patient right now.
Okay.
There's no definition for Billy. Okay. The only definition is Billy. Okay?
So I'm walking with a clean slate.
Yep. Clean slate. You can choose to pick up a drink, which is not real helpful to you right now. You can choose to say a liquid in a closed cylinder, in other words, a drink in a glass, is more powerful than you. But guess what? You can take that drink and you can throw it in the pavement if you want. You can throw it in the sink. You can do whatever you want. Obviously, it's not bigger than you are. You've chosen to make it bigger.
Okay, but...
Something tells me you're addicted to something called learned helplessness.
What is that about?
Can you explain
Learned helplessness is a really cool experiment that was done. We actually did it with rats originally. And it's where you learn to be helpless. That's your self-definition. And you don't know anything other than that. And let me tell you, it's a real easy gig. You don't have to perform. You don't even have to be kind. You don't have to do anything because you're all these poor, sad things. I'm firing you from all those roles, and I'm saying, babe, I have every faith in you.
But the thing is...
Start from there. What do you really want, Billy? You can't tell me you want to be happy. I don't know what the hell that means.
You don't want to be a rat.
Well, no, I do want to be happy. I don't want to be miserable.
Okay. You know what? Happiness is not something that comes in a static moment. It's not an overall blanket.
Okay, then...
Happiness is earned in little bits and increments.
Okay.
Happiness is, again, the bottom line is earned. Billy, my first question to you would be, what do you earn for yourself? Why are you worth knowing?
I find absolutely no redeeming quality right now in myself.
Sweetie,
yeah.
You've got a talented, really smart, incredibly cute lady who's spending her time on the phone with you. You've got two, from what I understand,
Dr. Tolson.
Pretty cool DJs using their airtime for you.
Yeah.
You have probably, at least a dozen listeners listening to this stuff. That's pretty cool.
Okay.
So obviously you're worth something, or else we're all real stupid.
No, okay, Dr. Olson, I can understand that, but the problem that this has hit me all of a sudden is, one morning I woke up and it just felt like, you know what, I cannot handle this anymore. It just felt like something internally snapped.
What is this? Define this.
Life, the pressures of life, you know.
Really? There's no such thing as the pressures of life. You're basically inventing something to stay helpless. Tell me specifically.
All right, I have a weight problem.
Okay?
Okay, I drink too much. I relapse.
Whoa.
Okay.
You're giving me the avalanche again. You're stacking up those snowballs and you're shoving them at me.
I have powerful women who I let control my life.
All right. Okay. we're lumping everything together. Let's start from square one.
Okay.
Do you want to take care of your weight problem first? Which is the most pressing?
Well,
Let's
I thought.
prioritize.
Ironically, I thought I did. I actually had the stomach stapling surgery.
And did that work for you?
Yeah, it worked, and then I started gaining weight again. And it's like, nobody gains weight again on this stuff. And it's like, I gained like 22 pounds, and now they want to put me back in for surgery again.
Okay. Do you want to lose weight first? Do you want to stop drinking first? Do you want to correct your relationships first? Where do you want to start?
I want to do it all now.
Okay, give me a place to start.
Come on, Billy.
Just one launch pad here, one starting spot.
Let's work on the women.
No.
You're looking for an overall solution to a myriad of small problems. You've chosen to lump them together. You are so addicted to being helpless and to victimizing yourself. That's what I don't accept. Fire yourself from all those roles.
But I haven't been helpless my whole life. It's like all of a sudden I feel this way.
I gotta tell you, there's something addictive about being a victim. Because guess what? You don't have to do. You don't have to have healthy relationships. You don't have to make the effort towards them. You don't have to be discerning about who you choose to love and be loved by. Because you let controlling bitches control your life. I mean, how easy is that? I'm saying let's fire you from all of those roles, all of those definitions you've given yourself, and start from a point of personal power. What does Billy want? And let's give it to him.
Billy wants to feel better. Billy wants to lose weight.
I don't know what that means. That's called an ephemeral. That's called something non-tangible. Give me an absolute tangible, because let me tell you.
Okay, Billy wants
your body
to. I want to lose weight again.
Okay?
Okay.
Let's get you on a program to help you lose weight. Off the air, I will give you my email address, and I will give you a program that I have used successfully for my 20 years of practice.
So you're suggesting I don't have the other surgery, or?
To give medical information would be irresponsible on my part without knowing more about you.
That's fair enough.
Okay, so we'll start from that. Then we'll start with the addictions, the chemical addictions. My guess would be, without knowing your history, that you're more addicted to being addicted than actually addicted. Does that make any kind of sense to you?
Yeah.
What does that mean? Not to me.
I'm sorry?
What does that mean, being addicted to being addicted?
Oh, and people love victimization. Let's face it. I deal with patients all the time, and the first thing I ask them, again, is, why are you here? And they give me a diagnosis. And the first thing I do is say, you're busted for practicing without a license. Secondly, so what? There's not a label, a name, a definition, or a DSM code I could give anyone that is helpful at all. Tell me precisely what you want. I don't want to put alcohol in my body to the point where I'm a drunk, I don't work, I don't make as much money, and I throw up all the time. That I can fix. Tell me you want to love and be loved. That I can help with. But people with ephemerals like, I want to be happy. Darling, we all want to be happy.
And that's wrong?
No, but it doesn't work to sit there and act and behave as if you're entitled to it, and if you don't get it, you're going to damage yourself.
Well,
happiness is not an overall right. It's something that's earned in increments. It's by doing really, really good work. It's by a moment with somebody. It's an incredible kiss. It's a fabulous dinner. It's a moment. And altogether, those moments are woven together into something pretty spectacular. Or they're woven into absolute, I can't swear, I'm on the air, or they're woven into absolute garbage. You know, we're just going to teach you to reweave a little bit.
We're going to have to tell Dr. Tulsa to watch the language on here.
Billy, are you picking up on any of this, or is it?
It's just it's different than my definition of what I've always believed. You know, my beliefs to be true about happiness.
Sweetie, do you want your beliefs, or do you want to get well?
You want to take a vacation from your problem.
It's not a vacation. It's actual real life. It's giving you tangibles. How can you point to anything
but why
and
is it?
say, this is mine, I own it, I did it, I created it, I invented it, I loved it and nurtured it? You don't have anything to point to, and you're saying, make me feel proud of me when you don't give yourself anything to be proud of.
Well, how do I increase my self-esteem? Because that's at an all-time low.
Sweetie, self-esteem, where is that? Show me. It's an intangible. I'm talking about tangible. You don't sit on a couch and say, give me self-esteem, I'm somehow bloody entitled to it. What you do is you do. For every moment that you're looking inward at your own misery, look outward. Do one incredibly cool thing a day. One. And pretty soon those days are going to weave themselves into a pattern where your life resume is just going to rock.
All right, let's suppose that he gets up in the morning, he starts feeling bad. You're saying get out of the house and do something fun. Do something
One time. These are not overall edicts. First of all, I don't know you. I don't know your history. I don't know your blood. The first thing I do is a complete blood chemistry. There's something called allergy-based addictions and a lot of other factors that could be mitigating here.
What kind of allergies do you think he could have? To maybe the barley or whatever he's drinking?
I'm sorry, I missed all of that.
What would he be allergic to? The ingredients of alcohol?
There are actually brain allergies where I could take a simple blood test and induce depression in anyone just by changing their blood chemistry. The real severe addictions that would cause psychological issues are pretty rare. So there is that factor. There's certain predilections for alcohol. There's an addictive gene. There are factors like that. My guess, you're inarticulate. You sound like a very sweet man, and you're certainly inarticulate. I think you might be, and I hesitate to say this, but you sound a little narcissistic.
I don't know.
And I got to tell you.
I agree with that, Doctor.
Yeah.
Pain
What does that mean?
I got to tell you, pain is the single most selfish emotion there is.
Yeah.
Let's face it, when we're in pain, there's nobody that counts but us.
Yeah, but it's not like he's not making up these things.
I know you're not, sweetie, but if you've got a mirror hanging in front of your face 24/7, how can you see outward? And I got to tell you, people like you, as sweet and as needy as you are, you probably cause as much pain as you feel.
Yes.
Well, that doesn't help.
Yeah, it does, because it's real. Why is it that I've known you 10 minutes and I like you more than you like you?
We don't know.
You haven't met?
Is that the way you honestly feel, though, that if she got to know you, that she would hate you, Billy?
Yeah.
I'm saying that you're just... Let's try this. It's worth a shot. If I were in a case where I were in pain all the time, I would try anything. If someone told me to stand on my foot and have sex with orangutans, I'd give it a shot. You know, anything in life is worth the adventure. And then all those adventures get woven together.
Well, let me ask you then, Doctor, about I'm on a ton of medications for my serotonin. I'm on the serotonin uptake re-inhibitors or whatever the hell they're called.
Exercise. What are you on?
Lexapro and Wellbutrin.
And Wellbutrin at the same time?
Yes.
Can you believe that?
Yeah, that's bizarre. I thought that was crazy, too.
Yeah, I am not a huge fan of psychotropics. I think they're a national epidemic. And I think they're unconsciously unprofessional to prescribe in the doses and to the degree. But again, I'm not going to step on anybody else's toes.
No. I'm actually, listening. I'm asking for your advice. It's not that you're in front.
I would personally have you off medication immediately, especially combined with alcohol. You can actually lose brain faculty. There's a thing called Wernicke's area of the brain where language is. And you become aphasic, where you stumble for words. And you're an articulate guy. I'd hate to see that happen to you. With Wellbutrin, prolonged Wellbutrin use, there's often something called tardive dyskinesia, which causes a twitch in the mouth. Just stuff you don't need.
Wow.
But think about it. You're sitting here just like a cupcake on a plate saying, oh, I'm not happy. All right, sweet? You're not happy.
Right.
How do we make you happy? What would make Billy happy?
Well, what is something that you said that I should do something every day? What would be like an idea of something that I should do?
I don't know you. Can you tell me?
Like drinking? If that makes me happy, or
does that make you happy, drinking?
Yeah, that's the only time. That's the only time I found myself to be truly happy.
Nonsense! You're such a fibber, Billy. You just told me drinking makes you miserable.
At the end, the next day, but when I'm drinking, when I'm drinking, getting high and stuff.
Okay, we're talking about something that works. We're talking about something that works.
Okay.
You've had enough Band-Aids.
What would make me happy?
You hate the shame of drinking.
I hate the shame.
First of all, I don't consider any liquid in a glass that powerful. So we're going to remove the term alcohol and alcoholism. Okay, you choose to drink, and when you do, you drink to excess, and it gives you baggage you don't need. It gives you shame. It gives you
remorse.
You probably throw up. You probably look like hell. You probably act like a jerk. It doesn't work for you.
No.
So you're not going to do that to yourself anymore.
Okay.
Just like hitting yourself in the head with a hammer would not be a swift idea. Neither is drinking. Okay?
Okay.
So can we make an agreement that between you and I, that you will not drink for No booze at all until Sunday?
This Sunday?
Uh-huh. Can you make that agreement with me?
Can you make that commitment?
Can you do that? No booze till Sunday.
Do we have an agreement?
Hold on. Okay.
You and I are going to have a contract.
Okay.
So your contract with me basically says, Dear Dr. Tolson, I, Billy, will not drink at least until Sunday, and then we'll renegotiate the contract. Okay?
Okay.
You will... Can I have one more thing?
Sure. Let's hear it
You will
first.
consider weaning yourself from the psychotropics with medical assistance.
Okay.
Okay? Can I have that?
Sure. I agree to that also.
Wow. Can I have one more thing?
Okay. This is...
Please?
You asked for one.
I know, but I'm cute.
Okay, go ahead. Let's hear it.
Okay? I want you to do one incredibly sweet, selfless thing a day that doesn't take you more than 15 minutes and doesn't cost you a dime.
I have no idea what that would be.
Do something nice for
and I
somebody.
want you to document it for me.
Pay it forward. You have to do something selfless, something nice.
Do something nice.
Okay.
Something
sweet.
absolutely wonderfully fun for you and for whomever you're doing it for.
Wow.
It can't cost you any money, and it can't take more than 15 minutes. And 15 minutes total. That includes thinking about it, executing it, and winding it up.
Can you give him an example? He's really stymied on this one.
Yeah, well, I need you to find your own. What would make you smile, Billy? What makes you smile?
Because I'm a pretty much isolated person. It's hard to do that.
You are so in love with being sad.
He loves it.
I
That's
want
true.
you to
He's a romantic.
Sad. Being sad sucks, and you love it. You're protecting it.
That part is very, very true, Billy.
It's going to take a lot to find, for me to that selfless thing to do. I mean, because that's so alien to me.
You're going to find one to do tomorrow.
All right.
Sweetie, these don't have to be larger than life. They don't have to be grandiose. I'm not looking to reincarnate Mother Teresa. I'm looking for Billy to do something where Billy has one moment viscerally that says, wow, look what I did.
Maybe if you could
That was
save
so
just
cool.
one baby a day.
I'm sorry?
If you could do something like save a baby or something.
You know what? Wouldn't we all love those opportunities?
I'm dying to.
But
That'd be great.
You don't get to save babies or rescue people from cars or drowning folk, or you don't get to do all these fabulous, larger-than-life things. And I think that's where your dissatisfaction's coming from, Billy. You want to be a superhero in your eyes, and if you can't have that, you don't want to play. Well, sweetie, you're going to play. You really are. Because you're worth it.
You got to play.
It's either play or take the easy way out.
What's the easy way out?
The suicide, that's what I'm saying.
Let's find you something fun to do. It can be the smallest possible thing. I once did this with a young patient. You know what he wrote me?
What?
We actually do contracts in my office, written contracts, and he came back in and he said, Doc, look what, and on his sheet all it said was, I didn't spit on the floor today.
See that, Billy?
So if
This
you
is
can
something
give me
that
a day
you
where you
normally
didn't
do.
spit on the floor, babe, you're ahead of the game.
Okay.
And that's selfless. Someone else didn't have to walk in that.
Exactly.
Okay, at least I have an example of something to
Maybe you'll try to hit the bowl in the men's room here.
Start and take care of that breath.
Hey, aiming, especially in the men's room, is a wonderful thing.
Yeah.
I'd appreciate it.
Billy, let me just tell you, life is a lot more fun than you're allowing it to be.
Well, I haven't seen it.
And it's a lot less serious. You don't need to be larger than life. I have a feeling that being Billy is going to be just fine.
You see that, Billy? You better now?
Well, she's giving me a little hope.
Doctor, how long would you think you'd have to... Billy gives himself before he starts to feel better?
I do something called pragmatic therapy, which is very aggressive. It's assignment-based, and it's patient-generated. So, again, we work really aggressively.
Right.
You would probably see me if you were in California for less than 3 months, probably about 10 to 12 sessions.
Wow.
Yeah, we work real fast. If I'm still seeing you in 4 months, I basically turn you over to somebody else, or we reassess the way it's going. The average length of therapy in this country is something like 6 years.
Right.
Well,
I don't know what the hell you do for 6 years.
that was one of the problems. I said to my therapist, I was like, I've been here a year and a half, and I feel worse now than I walked in the door.
Let me just say one thing that Dr. Tolson brought up, that you really seem to embrace this woe is me thing, no matter what kind of compliments you get or anything that you get from people. You love to hold on to that. There's something wrong with you.
You know, that's true, because if Billy does get a compliment, if he doesn't hear a punchline behind it,
Oh, he argues with you, right?
he'll add it.
They told me that in rehab
Let me
that
share
I
something
couldn't
with you.
accept
The
the
thing
compliment.
that I do, first off, called a life resume.
Not a compliment?
Just like a resume for work, but this is a life resume. Like, what right do you have to be on my planet? So you give me a resume to show me your place. And you know what most people put on their life resume? The first line is some victimization.
Right.
You know, I was hurt, I was molested, I was abandoned, I was divorced, I'm a drunk, I'm a this, I'm a that. You don't, no, you're not. You don't get to have any of that. Can I swear? No, I can't. You don't get to have any of that stuff on your life resume.
Jeez.
You get to have Billy.
Mm-hmm.
I'll allow you that. Get your name. You can have your age. You can have your gender. What's your best physical feature?
What's your best physical feature, Billy?
My hair.
Is there a B or a C?
Does he have nice eyes?
Do I have nice eyes?
Yeah, he has nice eyes.
he has
Okay.
nice eyes.
What color are they?
Billy
Hazel?
is male,
Hazel.
and who has nice eyes, and is very sweet. And that's all you get. And we're going to fill in the rest.
We're going to fill in the rest.
Okay. It sounds.
We'll leave on. We'll stop off with Hazel.
It starts.
You know, I would love to follow up on this. Please keep my email address, or feel free to. I'm going to give you guys permission to give him my number.
Okay. All right. Hold on. And we'll talk to you up there. Thank you very much, Doctor.
Thank you, Dr.
I had a
Tolson.
blast
Yes.
anytime.
Okay.
You're fun.
We'll have you back on again.
Terrific.
Somebody easier to work with. All right. There you go, Billy.
All right, now, was that fun?
It was very enlightening.
And you're going to take baby steps. Baby steps to the fridge, baby steps to the elevator. And you're going to take a vacation from your problem.
All right, this isn't an appointment. You're dropping by.
You're doing the work. You're not a slacker.
I'm starting with a clean slate.
All right?
Just think of them as think of your relationships like phone connections. This one's just temporarily disconnected.
You want to do it that way, Billy? When you get back from Scientology, it's a clean slate.
And you got this Dr. Tolson waiting for you, who wants us to give you her phone number, keep up with you on email. And what's that like? It's got to be great, huh?
Yeah, but I never said I was going to Scientology.
You're sailing. You're a sailor now. You sail.
To have a genius clinical psychologist right there for you.
Well, this is a lot, guys. I guess
This death therapy is going to cure you.
one way or another. I guess I owe you guys a big debt of gratitude for hooking this up to me and the guys from RonFez.net.
One guy.
Whoever it was.
You know who.
Thank you.
Howard Stern, Don and Mike, Bill O'Reilly, Ron and Fez and the Washington Redskins, 106.7 WJFK.